Hi everyone, how are you doing this morning? Topeka and I say good morning. I just got off from work. I wanted to make this video to let everyone know if you are on Facebook, there is a wonderful group, and the group is called Dentures for Young and Old, or maybe old and young and old I think it is. It is so well worth joining. There is so much information to be found on this in this particular group, and for people who are new to their dentures, you can learn so much. And for people who have had dentures for quite some time now, you can help others learn. This video today, it mainly goes out to people who work in the dental profession. Now, I am sure most of you are absolutely wonderful, and you really take pride in your work, and you care about your patients. But then there are some who do not, quite frankly, who do not. I have seen some really hard cases of patients who have come out of the dentist's office after having surgery, and their teeth are falling out of their mouth already, and they're swollen. These teeth do not fit their mouth from the get-go, and they will never fit their mouth. I'm talking to you, to those type of dentists and those type of so-called professionals. When we go to you, we're scared, or we're traumatized, we're emotional. We don't know what to expect. We don't know what kind of questions to ask. So give out some information. Let your patient know it's a year-long journey. Let your patient know it's going to take learning to talk all over again 2 or 3 times within that year. Learning to eat 2 or 3 times within that year. When you have your adjustments and you have your alignments, and when you go from your temporary set of dentures to your permanent set. Let your patients know this, because I, for one, wasn't told that. I was basically treated like I was in day surgery, and here's a piece of paper, and this is what you do for the next 5 to 7 days, and have a nice life. Okay. And yes, you know, they had me come back in every day for the first week, and then from there I went in once a week, and from there it started where I would go in once a month. I think that, you know, I had a fairly good dentist, but still, he didn't give out very much practical information. And as a dental professional, you should give out some really good practical information. Now, let's talk about eating. Okay, you're told that when you begin to eat, you should eat on both sides of your mouth at the same time. Who does that? Who's ever done that? That's very difficult to do. You're trying now to manipulate the dentures, to learn how to eat with them. There's something foreign that's bulky, and you feel like you have marbles in your mouth. And now, instead of chewing on just one side of your mouth like you're accustomed to doing, you're supposed to chew on both sides at the same time. Yeah, it doesn't work. I mean, it doesn't work. I tried it, didn't work, couldn't chew. The first 6 days after my surgery, liquids, that was it. That was about it. And baby food, liquid baby food, bananas, things like that, pureed baby food. Let your patient know that they're going to run into these kind of difficulties. And don't rush them into permanent dentures at the end of 6 months. They're not ready. Your gums, they continue to shrink for up to a year. If you want your patient to have a good fit and not have to wear adhesive, then by all means, give them about 9 months, if it's medically possible, before you put them in a permanent set of dentures. They'll get a much better fit. They won't have to wear nearly as much adhesive. And let them know some of the pitfalls that they're going to go through, like the talking. Teach them that they need to talk slow in the beginning, that they need to practice over and over and over and over again, repronunciating your words, learning how to speak again. Let them know that their gums are going to look like raw hamburger meat for about 6 months, because these things, they scare us, because we think, oh my gosh, there's something wrong. But there's nothing wrong. It's just the normal, natural healing process. But you, as the dental professional, you can make it so much easier on us. We're scared. We're traumatized. We don't always know how to ask you these questions. We don't even know we're going to come up against these kind of problems. If we're prepared, if we know in advance, excuse me, yes, you're going to talk like a 2-year-old. Yes, you're going to have difficulty in eating in the beginning. And give us some solutions as to how to deal with it. That really helps a lot. Let us know when we can begin to wear adhesive. Because if you begin to wear adhesive too soon, you can develop infections in your mouth. But you don't let us know these things. A lot of dentists don't take the time to let us know. And by all means, help us choose the right color for our teeth. Look at our coloring. Look at our eye color. Look at our hair color. You're the professional. That's why we came to you. So help us choose what is best, because sometimes we don't always know what is best. I mean, I'm not a dentist, so I rely on you and your judgment. I would say probably 98% of the dentists out there, they're great. But you got that 2% that they just butcher people. And I'm kind of really angry at that. I'm angry that people will walk out the dentist's office with teeth falling out of their mouth, or teeth that are so big they look like horse teeth. Teeth that are so obvious that they don't fit the person. You, as a dental professional, if that happens, and maybe when you did the casting of the teeth, something went wrong, maybe the lab messed up, bite the bullet and make your patient another set of teeth at no extra charge. Because after all, you're the one who messed up. It is horrible, just horrible, to go through this process and come out with teeth that don't fit properly, that traumatize you even more than the teeth you had in your mouth before you began. So take some time to realize we're human beings, and you're a doctor. You're a doctor. And so we come to you for advice, and we come to you innocent of all the pitfalls that can happen. And you need to let us know. Let us know so we can be more prepared. There's a great group of people that are on YouTube and a great group of people on Facebook. And we all wear dentures, and we all share our experiences. And I have made some great friends doing that. But we shouldn't have to, because you, as the dental professional, you as our dentist, you should be telling us what we're telling each other. Yes, we're all a little unique and different and original, and one size does not fit all. This is true. But the basics, the very basics of the talking and the eating and the fit of the denture, yeah, that pretty much fits into every category and every patient. So I just wanted to make this little video to let dental professionals know. Help us to help you to make us better. And by doing that, you'll have more patients, you'll have more business, because word of mouth will travel fast that you are a good dentist, that you make wonderful dentures, that you are worth going to. And we'll come back time and time again. I have my permanent set right now, and I've had them for about a little over a year, and I'm getting ready to have another set made as well. Will I go back to my same dentist? I don't think so, because he didn't take the time to tell me about a lot of things that were going to happen. And yet I thought he was still a fairly good dentist compared to some of the stories I've heard and the horror stories I've heard from others, and the actual teeth that I have seen falling out of people's mouths that just got their teeth, or the teeth that are just way too large to begin with, that absolutely, they almost look like the Joker from Batman. I mean, they're just too big for their mouths. Or people who have really super tiny teeth, and you can barely even see the teeth when the person talks or smiles. Remember, this is someone's life. This is their first impression when they meet people. We live in a society where we're judged on our appearance. So we want to make a good first impression. We want it to be a positive experience. But it can only be a positive experience with the help of you, the dental professional, who can help us and advise us as to what would be the best for us as your patient. All right. Everyone, have a great day. And don't forget to subscribe. Bye-bye. And Topeka says bye. Say bye. Say bye. Say bye. No, don't look at me. Look at the camera. Oh, Lord. One of these days. There she is. Say bye. Okay. Bye, everyone.